Hello, my name's Cary Adams and I'm the CEO of the UICC in Geneva. And it's a great pleasure today to introduce one of our partners, Sanofi, and one of their lead people, Zsuzsanna Devecseri, who is committed to cancer control, I know, as well as her team, and has been working with us on the issue of aging. Perhaps, Zsuzsanna, you could tell us a bit about yourself.
Yes, thank you very much. I'm Zsuzsanna Devecseri. I'm the Global Oncology Medical Head at Sanofi. I work with my team day by day across the globe to help clinicians and patients to address the issue of cancer. And the aging is one of my personal passion to deal with, as well as professional one. Both my grandmother and my grandfather-in-law lived very long, and they were cancer survival. So professionally and personally, I'm very attached to the topic.
Zsuzsanna, that's I think I meet so many people in our community who have the story of why they're in it is because of a family tragedy or a family member actually surviving cancer. So it's great to hear that we have lots in common. Now let's talk about the issue of aging, because you've been dealing with working with the cancer community for some time now as a company on the understanding the challenges that the older population have when it comes to cancer treatment and care, not detection as well. So how has the company done this, and why do you think it's been such an important thing for Sanofi?
So if you look around the world, we all know that people are living longer, and they try to contribute in the communities with many ways. We also know by numbers that the age brings up higher cancer incidence. And if you look at in 20 years, it's going to be increased significantly. If you just look people over 70, the number of cancer cases will increase more than 100%. And it will be a significant impact. It will have significant impact on patients, health systems, and also societies. We all want people to live long and to live well. So what we at Sanofi are driven by is a commitment to improve outcome. We knew from a while that there is a role for pharmaceutical companies to play. And that's why we launched When Cancer Grows Old initiative, which was a result of a very close dialogue with the cancer community and professional associations between great partners like UICC, the International Society of Geriatric Oncology, SIO, American Cancer Societies, but other stakeholders as well, advocates, patients, and providers. And this conversation helped us at Sanofi to identify key gaps in cancer advocacy, policy, and try to identify specific topics that cancer patients are facing across their care journey, starting from prevention or pre-diagnosis, and goes far beyond treatment or post-treatment and support. So we hope that When Cancer Grows Old continues to inspire everyone, advocates, healthcare providers, policymakers, but even other pharma companies, to help find solutions to help older patients with cancer as well as their families in a way we've never done before.
Zsuzsanna, you're absolutely right. I mean, we all know that cancer is really two of the key risk factors are aging, and a large number of people on the planet, leading to a greater incidence. So we know that. And at the World Cancer Leaders Summit coming up soon, we're looking at innovation and how that can address inequity. And one of those areas is how we can deploy innovation for the challenges faced by older people when they come to cancer treatment and care. So in your opinion, what are the major challenges which exist for the aging patients with cancer? What do you see them from a Sanofi perspective? What are those challenges?
So I think that there are probably two major changes that I would say that we see with cancer patients. The one is the first one that I would mention is a big one, is the patient journey. So when a cancer patient goes through the cancer diagnosis and treatment, it takes a physical and mental toll on them. But this toll is much, much bigger on elderly people because of their comorbidities, and also they need for extra help and support from caregivers and the society as well. The other big issue, I think, is public health policy, because in many countries, politics does not prioritize aging issues, and that results some suboptimal diagnosis and, unfortunately, suboptimal treatment outcomes among aging patients. And if this trend going to evolve, it is going to get worse in the following years as the number of patients will increase. So it is very critical that we work together and raise awareness about these issues and try to find and advance solutions to support cancer care of aging patients. And it should not be an individual responsibility. Multiple stakeholders need to work on it together.
Zsuzsanna, I couldn't agree more. I mean, UICC, certainly while I've been there, we've reached out to different sectors, different communities, because the UICC board has a very clear understanding that no one organization or even one sector alone can address the challenges that cancer patients have, or even prevention of cancer around the world. Now, in the last 20 months, we've had the COVID pandemic. And I think we've all learned through that process in terms of how important health is to governments, how important health is to society, how important strengthened health systems are. In terms of the older population, how do you think it's revealed inequities? Because that's one of the things that we've been conscious of in UICC.
Yeah, I think you are absolutely right. And while inequity in the cancer and aging community has been present and really evident for decades, COVID-19 has highlighted areas of unmet need with these demographics. Of course, it showed the data shows that COVID-19 as outcome. Cancer is a huge risk factor, and globally, age is a very strong predictor of COVID-19 severity and mortality. Cancer patients may be at even higher risk if they receive certain treatments which can weaken the immune system. So for us, COVID-19 has shown how much is at stake if societies do not adapt programs and do not find solutions that quickly address unique needs of these very vulnerable patient population. And we really need to work continuously to find solutions, how to support these patients' need. As we will go back and try to work on how to build back together, we have an opportunity to reimagine our programs, policies to ensure they are more age inclusive and take a more comprehensive view of aging patients' cancer care.
I think you've used two phrases there, which I love. First of all, the Build Back Better mandate that's been given by WHO to everyone, to governments around the world, to make sure as we prepare health systems for future pandemics, we cannot forget cancer and the other diseases which are still there. So for us, Build Back Better means actually addressing cancer as well. And the other phrase that you use is age inclusivity. Absolutely, that no age group should be, for whatever reason, should be disregarded with regard to that agenda. So that's something I know that Sanofi have always been very, very passionate about age inclusivity. So how do you think we can improve health outcomes in the future by building back better, working with governments, working with WHO and others?
What we at Sanofi, we will continue. And we start with a little bit selfishly start with us, and then we will talk how we can do better together. So we at Sanofi, we will continue to demonstrate our commitment to give opportunity everyone to grow old with cancer. And what we are trying to help stakeholders to address structural barriers and also provide a platform with Cancer Grows Old to help advance policy solutions as well. So these partnerships that we are building, including UICC, CEO, and other organizations, and as well as advocate healthcare providers, policymakers, it all just emphasizes the fact that these efforts cannot be done alone. It needs to be a structured and organized effort. Then everybody needs to contribute and everybody needs to take their part on this activity. On our part, we launched a sister or a sibling initiative of When Cancer Grows Old, the When Cancer Grows Old Global Contribution Initiatives in 2020, to provide funding to local organizations focused on cancer and aging, because we believe that everything starts in a place of care. Since the launch of this initiative, Sanofi awarded more than $300,000 to over 440 local nonprofit organizations, healthcare institutions, medical facilities, working to address gaps in the cancer journey to help people grow older. One of my favorite examples on this contribution initiative is an organization from Mexico called Unidos Asociación. Sorry for not being a Spanish speaker, but they host a first of its kind called Age Day to help patients and physicians better understand the unmet need of hematological cancer, including multiple myeloma, and advocate for broader access to treatment to these patients.
Well, I can say on behalf of UICC and probably all the cancer organizations who have received the support of your great company that it really makes a difference. It makes a difference. So when cancer grows old, a lot of organizations, particularly in the UIC family at the moment, have struggled financially to just do the basics over the last 2 years because COVID has impacted their fundraising as well as their work they do. So the support you provide will make a material difference, not only to the way they operate, but also the outcomes that they can achieve. So I must say thank you before we move on to the last question. So at the World Cancer Leaders Summit, oh no, we appreciate it. At the World Cancer Leaders Summit, we're pulling together a meeting with Sanofi, looking at how we raise the profile of age conscious with regard to the construction of national cancer control plans. Now, UICC for many years has set a start point for a country to understand its cancer burden and then take forward actions is to have a good registry and a national cancer control plan that's funded and supported. And in that, to make sure it covers all aspects of cancer control, including the challenge of an aging population. So we will have that conversation, but why is it important for Sanofi to be part of that campaign to some extent to get national cancer plans to become age inclusive, as you said earlier?
So as we discussed before, aging people with cancer and their families, they face very unique challenges, including inconsistent treatment and prevention guidelines, additional health problems, comorbidities, post-treatment support. Yet too often cancer plans are not inclusive or reflective of these needs. To address this, we are working with global organizations such you and the UICC to commission a study by KPMG to better understand the socioeconomic value of age-inclusive policies and national cancer plans. While the full report will be released on World Cancer Day in February next year, we look forward to discussing some of the initial insights from this work during our deep dive session at the World Cancer Leaders Summit. Conversations like this are critical to spark dialogue and drive action for a more inclusive, responsive policies that address the unique challenges faced by aging patients with cancer. And we are proud to be able to provide a convening platform to help unite partners. Collaboration between advocates, healthcare providers, policymakers, and communicators is crucial to help unite efforts and facilitate dialogue. So what we expect as an outcome, that to have a great dialogue with tangible outcomes and actions that we can all take together to the next step.
Well, Zsuzsanna, the great news is that because we're recording this interview and we'll be recording that actual dialogue, we can use it beyond the summit, which is the great silver lining from the Zoom world and having a virtual summit. So the messages that you've given will continue, and we will share them with the UIC members around the world. Before we finish, just once again, thank you very much for your support for UIC and its members. It is making a difference. Your team are fantastic and we enjoy working with them. Thank you for being part of the World Cancer Leaders Summit, and let's look forward to 2 days of virtual interaction and dialogue on some of the big issues that we have to address over the next 10 years or so. And of course, the challenge of an aging population is one of them. So Zsuzsanna, thank you very much. It's been a charm talking to you.
Thank you, and the thank goes to you and UICC and all the partners we collaborate. It is a true collaboration we are very grateful for.
Super, see you soon.
Thank you.